Welcome back for the next video installment. In this one, I'm going to show you how I prefer to take notes and outline my chapters. This is an alternative method to the outline I've already shown you. So let's just review a little bit before we go into this new system. Remember, we are in chapter 29. And we use these objectives to develop our test prep questions. So we turned all of these objectives into questions and wrote those in that test prep area. We did our vocabulary, key terms. We looked at the meanings of these words, how they're related to each other. We've done all of the vocabulary at this point. And I showed you one way to outline the chapter by using these headings. Now let me just back up to this for a second. I would ask my instructor for advice on how much of these concepts to study or how to study those. I'm not sure exactly how these fit into the grand scheme of things. I think that's a better question for your instructor. But remember, we already looked at one form of outlining. It was this one, where I used those chapter headings to develop this linear outline. And we went through quite a bit of the chapter using those headers to outline. And this is definitely a good way to do it. If this way makes sense to you, I would try it. It's the way I learned when I was in high school, I believe, and I used it for a very long time, but the other method works better for me, doesn't mean it will for you. Again, for this type of outline, I would bring this to class and fill it in as you're listening to your lectures. But the other method that I want to show you is based on the Cornell note system. And let me just show you a piece of Cornell paper looks something like this. And this is from, I believe it's Cornell Law School that students developed and used this system of note-taking. If you look on Google or YouTube, you can find all sorts of things, I'm sure, about Cornell notes. It's a very flexible system. You can adapt it to fit your needs. And this particular sheet of paper is the one I prefer. But I'm going to show you how to do this without special paper, just with notebook paper. So I'm turning over to my notes section. And the first thing I want to do is section off my sheet of paper. And there's a very specific process to this. So the first thing you want to do is section off a place for the header. And then maybe 4 lines from the bottom, let's draw another horizontal line. And then down the side, let's put about 2 inches in from the margin, a vertical line. And that's not perfectly straight, but it will do. So this sheet of paper is divided the way I want it to be. And then I'm going to use these headers to fill in what I need here. So the first one is just this title, Disorders of the Abdomen and Bowel. So this is sort of the overarching theme of this first section. And because I am very much a color person, I like highlighters and colored ink and pencils, I'm going to highlight as I go as well. So this is sort of that green color, that olive green. I'm just going to use a regular green highlighter to match this header right there. Then the first section, the first disorder, I'm going to actually number that, is made up of 2 disorders, but we'll group them together because that's how the book is written. Diarrhea or constipation. So we have that as a blue header. And just to keep myself organized according to the book, I'm going to go ahead and highlight that with blue. So the first disorder that they're talking about is diarrhea or constipation. And then I'm going to keep scrolling in my textbook. Then I come to this red header and I see the word etiology. Now, if this is the first time you're seeing this word and you don't know what it means, stop right here and go look it up. Don't wait for the next time, because the next time you need to know it. And a good way to do this is just to open an internet browser and Google the word. So here it even pronounces
etiology
for me and helps me learn to pronounce it. In medicine, it is the cause, set of causes, or manner of causation of a disease or condition. So really, there's just one word in there that I need to know, and that's cause. So let's draw a conclusion here. This is talking about what causes diarrhea or constipation, and we need to explain that. Now, this could be something you do in class by listening to lecture, or you could get that information from this text. Now, there are two different things going on here. Diarrhea is caused by one thing, I would think. Constipation, probably by something else. But let's see what this paragraph says. Etiology. When a person maintains a consistent diet and activity schedule, bowel motility stays fairly consistent. When illness or diet and activity changes occur, bowel motility is affected. So right there, they're giving me some causation. Illness, diet, or activity change, are both listed as causation factors for this condition, these conditions. Then it goes on to explain that diarrhea, the occurrence of frequent loose or watery stools, can be caused by a number of disorders. So this is where it branches off, and I'm going to say diarrhea is linked to a number of disorders. Constipation is separated. Is frequently caused by lack of fluid intake, medication, or immobility. I had surgery not long ago, and I was not able to move around for a long time, and I had a lot of opiates in my system. So I had a problem with constipation. It definitely relates to what I know about real life situations. So always bring your own personal knowledge into play here. What are the things you've learned just by living life? But it can be a symptom of a more serious medical condition. So constipation can also have a more serious cause. Now, the book doesn't elaborate on that, but it's worth noting because the book noted it. Notice what I've done here. I have not rewritten the paragraph. The paragraph's already written. I'm just trying to process what it's telling me about the etiology of this condition. And you notice I have not used complete sentences. I have not really even worried about spelling. I shortened the word medicine to meds. Use shorthand, whatever makes sense to you. You don't need to rewrite the textbook. You just need to pull out the things that make sense to you. Now, if I were taking the class that you're taking, I would do this prior to class. If I know that next week we're covering chapter 29, I would take some time on the weekend before to do this part, to go through, listen to the book, read the book, make the notes that I can find, and then go back through in class, maybe with a different color of ink, and add in the things that your instructor is giving you that would fit in these categories. But that's just how I would do this. Okay, the next one, we have treatment and nursing management. Now that's on the same level as etiology. So treatment and nursing management. Now the first thing that I notice here is that this paragraph is not by itself in this section. I have a paragraph here that starts at that top line, and then I have one down here. And let's see, there's actually a third one. So do you see those 3 paragraphs listed there? I'm going to approach that to summarize this section. So I need to highlight some in red, don't I? Can you tell it's been a while since I've used this method? We had etiology, and now we have treatment and nursing management. Those are in the red text. And under treatment and nursing management, there are 3 paragraphs. So I'm going to summarize those in my own words. Again, I'm not rewriting the book. We're just pulling out the bare bones that make sense. A thorough general health assessment is conducted along with a focused assessment. Medications for symptom control are prescribed according to the patient's symptoms. Drugs that have been used include bulk-forming agents, antidiarrheals, antispasmodics, antidepressants, anticholinergics or sedatives, and mild analgesics to relieve discomfort. And these are summarized in Table 29.1. A diet high in fiber may also be prescribed. Bulk-forming agents such as Metamucil or stool softeners may be recommended. So this is talking about treatment. It mentions assessment. So I would make a note that assessments are done. This is sort of a sequence of events. And then from that assessment, meds are prescribed. According to symptoms. And some of those include the ones listed there. You could list them if you want to be that detailed. You could also look at Table 29.1. So I'm just going to say C 29.1. So that's Chapter 29, Table 1. And then I'm also going to list high fiber diet. Now, I would imagine that would be for constipation. Stool softeners. So I'm just sort of summing up that section in my own words. And then we get to the next paragraph, and I'm going to make that a bullet. Gas-forming foods, such as legumes and those in the cabbage family, should be avoided. Avoiding onions, potatoes, cucumbers, coffee, tea, carbonated beverages, and alcohol may be helpful. Milk is restricted if the patient has shown evidence of intolerance to it. Lactase tablets may be used for lactase deficiency but are not indicated if an allergic sensitivity is present. So here are some more recommendations. It's telling me to avoid foods that cause gas, such as legumes, cabbage, onions, potatoes, cucumbers. Now, I may be going into way more detail than you need. If your instructor tells you this is too much detail, I am totally good with that. I'm just not sure how detailed we need to be here. Why would we want to avoid coffee, do you think, or tea? As you're listing these things, ask yourself those questions. Why would carbonated beverages be a problem? Why would alcohol be a problem? Milk is restricted if there is intolerance to it. Your instructors, who are very fine nurses, may have other recommendations that you would want to add here. Whatever works for you and your class. And I think your nursing instructors can give you much more advice on how much detail you need. Last paragraph here. Wearing loose clothing is more comfortable if bloating or increased abdominal pressure occurs. So here's some advice. Advise loose clothing. Instruct about medications and diet. So you as the nurse need to provide these instructions. And that brings us to the end. Instruct about instruction. I cannot talk and write. Sorry. How about instruct about medication or meds and diet? Again, I'm using shorthand because it makes sense to me. So I've written a lot here. I've written a lot of details, and that may not be necessary for what you're doing. You would just need to decide, is this necessary? Okay, that brings us to the second disorder, and that is irritable bowel syndrome, or IBS. And I'm not going to go through all of this. You get the idea. I do want to show you what that bottom section is for, though. So irritable bowel syndrome is the next disorder. And you see how these colors are helping me. These colors correspond to this outline. Let me go back to this one. This would be the green section. Let me get blue while I have it. There's diarrhea and constipation, irritable bowel syndrome, and then, of course, we had the green, disorders of the abdomen and bowel, and then we have the red areas. It's the same kind of thing. We are just using different paper, different forms of doing this. So whatever works for you is fine. Neither of these may work for you. These are just ideas that have helped me in the past. You could even do both of these methods if that's helping. Okay, so back to my notes. Let me do one more on irritable bowel syndrome. I'll get this, then I'll be out of space. But Irritable bowel syndrome, or IBS, is a functional disorder of gastrointestinal motility. Stop here and make sure you know what gastrointestinal means. Gastro makes me think stomach. Intestinal makes me think intestines or bowels. So it is a gastrointestinal issue or a GI issue. Now, if you already know what that means, I would not waste time writing that down. I'm just showing you, if you don't know these terms, now's the time to learn them. In the United States, more people have IBS than diabetes or asthma. I did not know that. So IBS, irritable bowel syndrome, in the U.S. is greater than diabetes. I had no idea of this. Or asthma. I do have asthma. But IBS is larger than those diseases in America. And IBS is a major reason for missing work days. In North America, IBS is far more common in women than in men. So the incidence in women is larger in women than in men in North America. You notice the shorthand. I'm just making notes as I go through. And then we are back to etiology. And remember, that word means cause. So we need to know the cause of IBS. So let's read. The cause of IBS is unknown. So cause is unknown, but is currently being researched. At this time, it is thought to result from a hypersensitivity. Hyper means over, too much, of the bowel wall that leads to disruption of the normal function of the intestinal muscles. So the theory, to me, that's a question mark, is hypersensitive bowel wall. That affects intestinal muscles. Okay. And then again, in your lectures, your instructor may provide you more details that you want to make note of there. So leave yourself some space to squeeze that in. Okay, I'm going to stop. I'm to the bottom of this page. I'm going to show you what to do at the bottom of the page. But I'm going to make this full screen if I can. I'm taking away the textbook if I can. There we go. And bringing this full screen so I can zoom in. So this is a page of your Cornell notes as far as I had space. And I'm now to this bottom section. And this is the part of these notes that make them so beneficial for me. You can put a lot of things in the bottom section. I've seen students write definitions down there. I've seen them write homework assignments, lots of different things. But the way I use it is for test prep. I look back at this page, just what I have on this page, and I think of some questions that could be on a test. So at this point, here's a question. Name 3 disorders of abdomen and bowel. Now, I don't write the answers. I'm just writing the questions because the answers are found in these notes. This is where, as I'm reviewing for my test, I'm reading the questions on the bottom. If I can't answer these questions from memory, then I go back in my notes. If I can answer them, then I just keep going. Here's another one. We could say, let's see, let me think of which. Let's not do which because that is a open-ended or a multiple choice question. Which disorder has an unknown cause? This is a very good place to work with your peers. Give them the questions you've written and have them give you the questions they've written. And I bet that together you'll come up with the questions that will appear on the test. You might also ask your instructor to suggest some questions that should go down here. And one more. This is one that really is not answered on this page, but I think it's worth thinking about. Why might coffee and tea aggravate bowel problems? Maybe that's a discussion question that you could have in class. Okay, so I have taken these details that I've pulled from my notes and I've come up with my own study questions. I think if you can come up with 3, you would be in very, very good shape. So that tells me if you've got 3, it means you've got some good notes there. So I would probably highlight those in another color. And then eventually I may even move them into this test prep section. Okay. And so far I can't really answer the questions that are here in my test prep section. I've not gotten to the characteristics of IBS yet, but it's coming. So these questions I've not found the answers to yet. You will though. But I have found some new questions that I would want to review as I review my Cornell notes. Okay, so on the next page, you have another set of notes. I would just pick up with that reading and continue on to the bottom of that page. Now, I will tell you that this method takes a long time. This is a very in-depth way of studying. So you can adjust it to fit your needs. If it's too detailed, just back it off to the way that you want it to be. Don't forget about your vocabulary section. As you find things that you may want to add to this section, come back here and add it however you're doing that. And that way you are building your own set of vocabulary that will benefit you throughout your nursing career. Any exam you have to take, this will make a very good review. Okay, the last thing I need to show you is the table of contents, and I'm going to make a separate little clip for that because this one's getting a little bit long. But we'll finish up, and that will be the end of the tutorial.